Welcome to Dental XP. I'm Dr. Sergio Rubinstein, co-author of the article recently published in the Journal of Cosmetic Dentistry. The article is Anterior Extraction and Implant Placement in a Severely Deficient Site, Multidisciplinary Enhancement of Hard and Soft Tissue Profiles. This article is linked to the following lecture here at Dental XP, the Comprehensive Dentistry Simplification of the Complex Case. What we're going to talk about is, well, we know clearly it's important to have a proper diagnosis and astute treatment planning that is the blueprint for a successful outcome. We're also going to talk about cosmetic dentistry, different cases, anterior and posterior cases. We will talk about implant concepts, as well as showing some simple and complex cases. When we have a patient with an anterior fracture incisor, we know that we have several treatment options, and materials are available that will provide an excellent outcome. The key is, what is the best option for this young patient, 18-year-old? And will we treat any differently a patient that requires treatment for a posterior tooth? Here we have a 14-year-old girl who just underwent endodontic treatment. Are we going to need a crown? Does this tooth require a post? Are all prefabricated posts the same? And here we have an older gentleman who has a major problem, has been diagnosed to have a cyst, and with 3 different consultations with oral surgeons, they have suggested to extract the canine and premolar. But no one bothered to tell him what this defect was going to look like after the extraction of the canine and premolar. Will the lateral incisor be able to be maintained because of the narrow proximity and poor bone in between? And the case that's linked to the article, where this patient had lost the entire or most of the buccal plate on the upper central incisor. What are our treatment options? This is what we're going to cover in the lecture. We're also going to talk about how to create a provisional that's going to be the guidelines for our lab technician to create a final restoration with an aesthetic outcome. So here we can see in these slides the provisional that was delivered at the same appointment. This is done chairside with no need of using a laboratory technician. And the case that's linked to the journal, where we need to do a close evaluation not only from a cosmetic perspective, but a healthy result as well. We know we have many options on how to solve this problem, which one is the best one for the patient, which one will provide the best outcome. This is what we're going to cover on the lecture. Once we are able to correct the problem, we like to do some computerized tomogramming planning that will enable us to place the implant in the best possible position and be able to obtain an aesthetic outcome. Here we have a patient with 2 individual provisionals. This was accomplished through proper vision, communication that we like to establish as a team, and proper execution. Thank you for listening to this lecture.